Hi, my name is Ken Jones. I'm a financial advisor here at the Binnacle Group, and I'm going to be going over a few things about turning age 65 and first becoming eligible for Medicare. So the first question you want to ask yourself is, do you need to enroll? Do you need to enroll in Medicare at all? Well, ask yourself, are you carrying employer-sponsored coverage? Do you have coverage as an employee, a spouse, or a retiree? In most cases, you do not need to enroll in Medicare if you're carrying employer-sponsored coverage. Talk to your HR department and see if you need to do anything at all. Now, if you're carrying individual coverage, you will need to enroll in traditional Medicare. So if you're carrying individual coverage or your employer-sponsored coverage says you do need to enroll in Medicare, the question is, how do you enroll? Well, if you're collecting Social Security already, you will be automatically enrolled about 90 days before your 65th birthday. If you're not collecting Social Security, you will want to go to ssa.gov and do the online enrollment. You can also go down to your local Social Security office and enroll in person, or you can do it over the phone. If you want to call 1-800-772-1213, you can initiate the enrollment into traditional Medicare that way. Now keep in mind that traditional Medicare will start the first of the month prior to your 65th birthday. It does not start on your birth date. It will start the first of the month prior. So when you do the enrollment through Medicare, you will automatically, you'll be enrolled in Part A, which covers your inpatient hospital. And currently in 2019, if you or a spouse have worked for 40 quarters or more, there is no cost to Part A of Medicare. Now Part B, which covers your doctor's insurance, is currently $135.50 in 2019 for most people. If your income is above $85,000 for an individual or above $170,000 for a couple, you will be paying more than the $135.50 for Medicare Part B in 2019. Now, after you complete your enrollment for Medicare's Part A and Part B, look out for the card that's going to come in the mail. And I want to highlight this, that it's not a traditional card like a health insurance card. It's not like a credit card. It's going to be more of a card stock that you will have to cut out of a piece of paper. I often see these thrown away. People just discard them. So just keep an eye out in the mail and take a look for it. Now, after you've enrolled in Medicare Part A and you've enrolled in Part B, realize that it's not complete coverage. It's not the employer coverage that you've been used to. It's not the individual coverage that you're used to. You are going to want to pick up a supplement plan or continue carrying your employer-sponsored group coverage. And in order to do that, my suggestion is to first gather your doctor's information, gather your prescription information, and seek out an agent like myself to help assist you with the enrollment. There's a lot of nuances involved in picking out a supplement plan to go along with Medicare. There's also the Part D, the prescription drug side of it, that you want to take a look at. Some of the nuances there are going to be some of the drugs fall under Part B, some of them fall under Part D. There's also some doctor networks to be concerned with. So that's why I would suggest seeking out an agent to help you facilitate that enrollment into a supplement plan. So thank you for watching this, and we look forward to seeing you on the next video, which we will walk through your couple of enrollment options into a supplement plan.